Hi friends. So this side Dr. Sonu, and today we'll take up that topic without which the second year exams they are not complete. Definitely they will ask a question regarding the typhoid fever and UTI. So first of all we'll talk about typhoid fever, and then I will give you some insights in the UTI also. Okay. So both these topics are such that definitely one or two the second year exams they are not complete. Okay. So definitely one or two questions in the form of short questions or long questions, or in a form of case scenarios will definitely be there in the exam. Okay. So let's start up without wasting time. First of all, regarding the typhoid fever. So it will be good that if you're able to answer up in the comment section also, like which all things which I ask up. So that will be more interactive. थोड़ा interactive रहेगा, that particular stuff. So it's good if you interact up in that. Fine. So first of all, the typhoid fever, or I should ask in this way, that which organism does typhoid fever? Yes, please. Which organisms does typhoid fever? And it's a more second prof oriented one. I know a lot of other ones, they might have joined up. So in that orientation only will go. So the typhoid fever, as you know, and as you have answered also, that is Salmonella typhi. Okay. This is the one which is, just a minute, let's make some changes. Yeah. Salmonella typhi is the organism which leads to this typhoid fever. Okay. Now, important is that one more word comes, and that one more word is what? That one more word is enteric fever. Okay. That one more word is what? Enteric fever. So tell me this, that is typhoid fever and enteric fever, are they same or are they different? Yes. In the comment section, you can tell, in the YouTube also, and here also in the chat, that the one which you are seeing up in the screen, Salmonella typhi, causing up typhoid fever, and one name is enteric fever. Are they same or are they different? So basically, if you say crudely, so both are same, typhoid fever and enteric fever. But technically, that enteric fever is a broader term, and enteric fever is by what? Salmonella typhi, along with paratyphi A, B, and C. These are also there in this particular one. That is the Salmonella typhi along with paratyphi A, B, and C. Okay. So basically, if somebody talks up na, in the Viva and all, so you should know that enteric fever is a broader term which includes up along with Salmonella typhi what? Paratyphi A, B, and C. Is it fine? Now, other than that, in the case of Salmonella, you know that this belongs to which particular family? Enterobacteriaceae. Okay, Salmonella typhi belongs to Enterobacteriaceae, and this particular organism, Salmonella typhi, or I should say Salmonella, not exactly typhi, they all are being classified by a scheme that is termed as Kaufman-White scheme. Okay. So now you should know this much only, that there is something called as Kaufman-White scheme, by which you tend to classify the various Salmonella. Okay. And how many different types of salmonellas they are there according to this scheme? Around 2309 serotypes are there, which you classify according to this Kaufman-White scheme. Just the name, at least now you should know that which is the scheme which is being used to classify the salmonella. The answer is Kaufman-White scheme. Okay. Now, besides this, you should know that the typhoid fever spreads through which particular way. So this particular typhoid fever, as usual in India, it is fecal-oral contamination, which is there in this. Fine. Fecal-oral contamination is there in this particular one. And the incubation period of typhoid is around how much? 7 to 14 days. Okay. What is the incubation period? 7 to 14 days. And this particular 7 to 14 days obviously is what? How much? 1 to 2 weeks is the incubation period of typhoid fever. Important here is how does this particular typhoid fever happens? And which particular cells are involved and which unique way by which the pathogenesis of this happens, that also you should have certain idea regarding it. So basically, first of all, every organism which goes inside our body is having a loading dose. Okay. Without that loading dose, it can't do the infection. Means a critical one that this much amount is needed to does the infection. And what about the Salmonella typhi? It is this number. 10⁻³ to 10⁻⁶ bacilli should be there to do the infection. Okay, this much should be there to do the infection. Otherwise, infection will not happen. So first point is that. Then, obviously, much of the student doesn't go into the deep of it. And you must have heard of a particular cells here termed as M cells. Okay. So this you should know that in the pathogenesis of this particular Salmonella typhi, certain cells are involved up that is termed as M cells. And M cells are which cells? They are mucosal cells which are present in this. Okay. So these mucosal cells, they play a part in the pathogenesis of Salmonella typhi. First thing is that. Okay. Then a unique type of a thing which is observed here is BME. And what is BME? BME is termed as bacterial mediated endocytosis. Okay. Bacterial mediated endocytosis. These two things, these two names, one is M cells, that is mucosal cells are involved up. And this particular one, bacterial mediated endocytosis, is performed by this bacteria to avoid the killing. So these two names, if you specifically mention them in your question, then you will get 1 mark extra for sure in your exam. M cells and bacterial mediated endocytosis. This particular organism also loves to stay within the cell, and it have various mechanisms by which it avoids its killing, intracellular killing inside the macrophages. So every bacteria which tends to do some disease tries to survive intracellularly inside the macrophages also. They will try to survive by various mechanisms, like they have tier 3 system, 4 system, 4, 5 system. So they are bit difficult ones. Don't get into that. Okay. Just remember of that M cells are there and bacterial mediated endocytosis is there. And in the case of typhoid fever, there is firstly, they are in the lymphatics, and after that, they go into the blood. And that is what is termed as primary bacteremia. And later on, the secondary bacteremia happens. Fine. So this is what is which you need to write up in the exam, that how does the infection happens. Mostly in India, it is fecal-oral. Incubation period is how much? 7 to 14 days. Then how much is the loading dose? Loading dose is this. If this much bacilli is not there, then the infection will not happen. Then you have which particular thing? M cells, that is mucosal cells involved in this. And other thing is what? Bacterial mediated endocytosis. And due to all this, what they want to do, the bacteria wants to do, the bacteria wants to survive up. Okay, bacteria want to survive up, and in fact, when the macrophages engulf it, it survives inside the macrophages also, and thereby leads to what? Primary bacteremia, and later on leads to what? Secondary bacteremia stuff. Okay, so that is what is termed as in this particular one. Now, talking about the various features which you observe in this particular fever. The fever is which pattern? Everybody remembers and must have done also nowadays in the second year. That is step ladder pattern. And it is there in the second year now in the bloodstream infections and all. So that particular bacteremia which happens up, that is there. The step ladder pattern. And what is step ladder pattern? That it keeps on increasing, comes down, but never touches the baseline. That is what is termed as step ladder pattern of fever, which is observed in the typhoid fever. So first point is that. Second is, in this, certain spots are seen, and those particular spots are termed as what? Rose spots. Over the trunk area, okay, backside also and in front also, you can get up certain spots which are termed as rose spots, which are characteristic of typhoid fever. So this is one of the things which you need to remember. Other than that, in this particular typhoid fever, there might be a diarrhea stuff, that is pea soup diarrhea. Okay. Or there might be what? There might be constipation. There might be constipation. So either way it can present off with a pea soup diarrhea or constipation. Fine. The typhoid fever can present up with diarrhea as well as sometimes with constipation. That is also one of the points to be remembered. Now, other than that, if we talk about the complications of typhoid fever, the complications of typhoid fever are what? The complication of typhoid fever is GI hemorrhage. Okay. And there is perforation. Okay. GI hemorrhage and intestinal perforation. And this particular perforation is having which type of ulcer? Longitudinal, transverse, or flash shaped? It is having a longitudinal ulcer. It is having a longitudinal ulcer. Fine. So there is a GI hemorrhage, which can be potentially dangerous. Along with that, the perforation, intestinal perforation, and there is a formation of what? Longitudinal ulcers in this particular one. Is it fine? Now, after all this, complications and the features, along with that, what else you should know here? You should know that there is a sign in this particular one that is termed as Faggot sign. And this Faggot sign is what? This Faggot sign is relative bradycardia. Okay, what is this Faggot sign? It is termed as relative bradycardia. Means we know that with 1 degree increase in fever, there is an increase of 10 beats per minute. Here, the increase is not 10 beats, it is hardly 5 to 6. So that's why we say that this is what? This is relative bradycardia. Okay, this is what termed as? This is termed as relative bradycardia. Is it fine? So Faggot sign is seen in the typhoid fever. It is also seen in the brucellosis. And number of other are there in which this particular Faggot sign is positive. Along with that, a unique thing is observed, that is in this you might have leukocytes less, okay, leukopenia sort, okay, not exactly we'll mention it as leukopenia, but decrease in the leukocyte count might be observed. As such, what we say that in every fever, what increase? The TLC increase, but in this, the total leukocyte count can decrease also. It can be normal or it can increase also. Means every sort of picture you can find out. It can decrease, it can be normal, or it can be increased also in this particular typhoid fever. What? Total leukocyte count. Okay. Now, other than these particular points, let's talk about the lab diagnosis of this particular typhoid fever. Okay, so these are the clinical features which you can find out, and according to them also you can make the diagnosis. And typhoid fever is obviously common in India. So regarding the lab diagnosis, if somebody asks you, in the lab diagnosis, remember the famous mnemonic BASU. Okay, in the lab diagnosis, remember the famous mnemonic what? BASU. And what is there in the BASU? B is blood culture. Okay, also termed as which you can do is bone marrow culture. A is agglutination. Okay, A is what? Agglutination. S is what? Stool culture. And U is what? Urine culture or urine ELISA. Okay, urine culture or urine ELISA. That is there according to this lab diagnosis. Now, important thing to remember is what in the Viva and in the exam also, that this BASU, student confuser, it is in the days. No, it is in the weeks. In the first week, you have to go for blood culture or bone marrow culture. Okay. In the second week, it is advisable to go for agglutination, that is Widal test or Widal, whatever you call it. Fine. In the third week, it is stool culture. And in the fourth week, it is urine culture. Better is urine ELISA. Okay. In the fourth week, better is what? Urine ELISA. And third, it is stool. Second is agglutination. First is blood culture and bone marrow culture. Is it fine? So this should be clear that if the examiner asks, because the questions they come in this way, that on the third day of the fever, which particular investigation you will do. So answer of yours will be blood culture. Okay. On the fourth day of fever, also your answer is what? Blood culture. So important to remember is that in this mnemonic BASU, it is not the days, it is the weeks. First week, second week, third week, and fourth week. Is it fine? Then, important is to talk about them one by one. Regarding the blood culture, important is that which one is better, bone marrow or blood culture? So guys, if they ask this way, then obviously the bone marrow culture is good. But obviously, which is practical to do is blood culture rather than the bone marrow culture. Okay, practical to do is what? Blood culture. So obviously, the one which we do is blood culture mostly. And in the blood culture, you should know what should be the ratio of the blood and the culture fluid. The ratio of the blood to the culture fluid is 1:5. Okay. 1:5. It used to be 1:10, but preferred one now is what? 1:5. Means if you are taking up 10 ml blood of somebody, then how much culture fluid you should take? 50 ml of culture fluid you should take. Okay. So if you have 10 ml of blood, then 50 ml of culture fluid. And which culture fluid is preferred up? The culture fluid which is preferred up is what, guys? Bile broth. Okay. Because the Salmonella typhi loves bile. This you need to know. The Salmonella typhi what? Loves bile. So this is bile broth. Then other than bile broth, what you can use? You can use glucose broth. Okay. You can use glucose broth also. Fine. So 1:5 ratio, 10 ml this, 50 ml of bile broth or glucose broth that is being used up. Preferred one is bile broth for sure. And this particular combination, it is to be checked for how many days? 7 days. So blood culture report, if somebody asks you in the Viva, comes in how many days? 7 days. And the initial report, initial blood culture report, this particular one comes in how much time? After 3 days. And the final blood culture report, that particular one comes after 7 days. Okay. So this also is an important stuff which you should know as a doctor, that the blood culture is not given up in 1 or 2 days. It is being given a final report in 7 days. In fact, after 7 days. Now, another thing is India is a country in which that most of the patients already had the antibiotics and that antibiotic failed. That's why they are going for the blood culture. Otherwise, they never bother to go for culture and all. So the problem of isolation is that in this blood, what we have antibiotics also. So how to remove that antibiotic effect? So removal of that antibiotic effect is by removal of that antibiotic effect is by what, guys? It is by a particular substance termed as what? SPS. Okay, what is that particular one? SPS. And what is SPS? SPS is, here, this side I'm writing up, SPS, sodium polyanethol sulfonate. Okay, what is that? Sodium polyanethol sulfonate, that is there, which you add up to this blood culture bottle. And why you add up? Two things it does. One is antibiotic effect, which is there, that will be neutralized. And another one is this behaves like a anticoagulant. This particular one behaves like a anticoagulant. So two functions are there of this SPS. So they might ask you in the Viva also that in that blood culture bottle, what you add? You add SPS. And what is SPS? Sodium polyanethol sulfonate. Clear? So this also should be clear to you that SPS is added to the blood culture bottle and it have dual action. One is removal of antibiotic effect because already the antibiotic is being taken in India before culture, and anticoagulant effect it have. Now, if the options is given, which is better, bone marrow culture or blood culture? Bone marrow culture is better than the blood culture, but obviously bone marrow taking is not easy. It's not feasible. So that's why we go for what? Blood culture. Okay, and we have to wait up for how much time for the final report? 7 days. After 7 days, only the final report of blood culture can come. Yes, initially, if the indication is there of any growth, that will be given up after 3 days. Is it fine? So this is the story of blood culture, which you should know. Now, after that, it is being said in the second week, agglutination is being done. Okay. And this agglutination is of what? This. That is Widal or Widal test. Okay. And this particular test, what you measure up in this particular test? Antibodies. Antibodies against what? Antibodies against O and antibodies against H. What you measure in this? Antibodies against O and antibodies against H. Now, first of all, this question only came in the NEET PG also this time, that what is this H? H is flagellar antigen, guys. So this particular Salmonella typhi is having flagella. And this O is termed as what, guys? This is termed as somatic. Okay. So antibodies against O and H, that is somatic and flagellar, that is there in this particular Widal test, that is estimated. What? The antibody titers. Against what? O and H. And what is O? O is somatic. What is H? H is flagellar. Is it fine? Now, if somebody asks you that what is this O actually? This O actually is the Greek word one. And this H actually is what? 𝗏. So one and 𝗏, these particular names you should know they are of this particular O and H. They can ask you this also. One is somatic and flagellar one is Houch. Now, this one, most of the persons, they don't understand that what is this Widal test and all. So basically, this is of two types. One is slide Widal and one is tube Widal. One test is what? Slide Widal, and one test is what, guys? Tube Widal. Now, you tell me which one is better. Which one is better? Is it slide Widal which is better? Is it tube Widal which is better? Yes, anybody wants to comment upon that which one is better in this? Acha, now I could able to see your comments. I could able not able to see only your comments. Okay, 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 okay. So basically, first of all, I tell up this slide Widal and tube Widal. That is the one. Which one is preferred? Yes. Anybody in the comment section, if you want to tell up that which one is there, which is being used up mostly, slide or tube? Which one? Please tell. Yes, please. Anybody comments? Any comments? No. So tube Widal is better than the slide Widal. And why we say so that the tube Widal is better than slide Widal? Because in the tube Widal, what you can do the dilution. Okay. In the tube Widal, what you can do the dilution. And because of this dilution, what can happen? Because of the dilution, the removal of a phenomena. Removal of which phenomena? Prozone phenomenon. Okay. So another viva question of yours, that what is prozone? Prozone is what, guys? Prozone is antibody excess state. Okay. So certain reactions are there in which antibodies are produced more. Certain reactions you can say, or certain diseases you can say, like brucellosis and all, in which antibodies they are produced more. So here also this is one thing which happens here. Antibodies are produced more, and because of this antibody production more, what happens? Prozone phenomena. And what is prozone phenomena? Because of this, what happens? Proper lattice is not formed. And that lattice, how it will be formed proper? When you dilute the sample with a normal saline. Okay, so that is there. Then that will come into which particular zone? Zone of equivalence. And that's why we say that it will be the best for the lattice production. Is it fine? So this you should know. That tube Widal, this is the reason. If they ask up na, that which one is better, slide Widal or tube Widal, answer is tube Widal. Why? Because dilution is possible and you can remove of which particular phenomena, prozone phenomena. That's why tube Widal is good. Now, commonly done one is what? Slide Widal, because it is easy to do, and tube Widal is difficult to do. So obviously, which one is preferred to be done? Slide Widal. For the early diagnosis, slide Widal is done. But yes, better one is which one? Tube Widal, because you could able to remove effectively what also? The prozone phenomena. Okay. So that is also one of the important things to be remembered. Now, in this Widal or Widal test, important is that antibodies against O, they should be given a number. That number is, if somebody's antibodies are more than 1:100, okay, of the O, and against the H, it comes out to be more than 1:200. This particular thing, okay, more than 1:100 for O and more than 1:200 for H. This particular one is the antibody titers which are being given up as a, you should give some baseline. Na? So that is what is the baseline, that above this, you can suspect up that the patient might have what? Typhoid fever. That is over 1:100 for O and over 1:200 for H. Okay. But obviously, this is not constant, because Widal test depends on what particular thing? the cleanness index of that particular area. So you can't fix it that this particular one above you will be termed as typhoid fever positive. No, the local doctor knows the local titers of that particular endemic zone. So that is the best person to decide upon that this is the typhoid fever or suspected typhoid fever and all that. Okay. It is being said that if above this, let's take this, above this is suspected TB, this particular typhoid fever patient. Now, basically what they ask is that after 2 weeks, okay, these all is theoretical, that after 2 weeks, you repeat the test, repeat the Widal, and in this, there might be a fourfold increase in titer. Fourfold increase in titer after the 2 weeks. Then only you say that this particular one is a confirmed case of typhoid fever. Okay. So nobody have the time that after 2 weeks again will come for the Widal test and all. So obviously these all are theoretical things, but still you should know that in a gap you should go for it. And the gap is what? 2 weeks, and after that you see the titers. If it is fourfold increase in titer, that is a confirmed case of typhoid fever. Okay, but obviously these all are theoretical. Nobody have the time that after 2 weeks again it will come for the repeat Widal and all. So, but in the 𝗣𝗲, you have to tell up this thing that after how much time you can repeat the Widal and how much is the titers look out. Fourfold increase in the titers should be there. Okay, of the initial one, not this initial one. Okay, so this is regarding this. And important is why this particular test is losing its sting. Because there are lot of reactions in which the Widal test comes positive. Like it can come positive in various other diseases also. Like that is biologically false positive. And biologically false positive, it is in which all diseases, guys? In the IM, infectious mononucleosis. Okay. Everybody was confused when the COVID-19 pandemic was going on. Widal test is coming positive with them. So this is because of cross reactions. So biologically false positive reactions, they do happen in Widal. So coming positive of it doesn't confirm up that anybody is having typhoid fever. So infectious mononucleosis, COVID-19, even malaria, these are the ones in which this particular one, 𝗘max, UTI, I think will not be able to cover up today. Next class will do the UTI for sure, 𝗘max. Okay, as you are asking in the comment section. So UTI will be covered in next. And today we'll cover up this typhoid. How much we can able to. Okay. Hi Sanjay, good evening. So biologically false positive happens to be in whom? Infectious mononucleosis, COVID-19 even, malaria, and nephrotic syndrome. If somebody is having, in that also this test starts coming positive. Okay. What else? Acha, you are telling UTI also. Okay, okay. Might come. It is like cross-reactive. It might come in UTI also positive. So infectious mononucleosis, COVID-19, malaria, nephrotic syndrome, they are the important ones. Certain autoimmune diseases like SLE, and as you are telling up in the comment section also that in the UTI also, yes, it can. So that tells these particular biological false positive things, what they tell, that it is not a very good test. Okay, Widal test is not a very good test. It is a time pass test. Actually, it is being said that it is a highly sensitive test, but poorly specific test. It is highly sensitive test, but poorly what? Specific test. Okay. So it is highly sensitive, but poorly specific. Which one? This Widal. Is it fine? Hi, Manish. Okay. So high sensitive, poorly specific test is Widal test. And that's why nowadays, what they have started doing up, they are going for this IgM Typhoid.CART test rather than Widal. They are preferring up. It is easy to do also, and you get the results also fast, and sensitiveness and all is also good. IgM Typhoid.CART test, and any sort of a CART test which you know, any sort of a card test depends on which principle? Immunochromatographic principle. Okay, which principle is there of most of the card test? Immunochromatography. Another question asked, and another viva question, that the card test, they depend up on which principle? The answer is immunochromatography. And what is immuno? Immuno is antigen, antibody stuff. Chromato means color. Graphy means paper. Which paper? Nitrocellulose paper. Okay, nitrocellulose paper. Okay. Why Widal is positive in UTI? As such, you are telling up. I have not seen up till, but yes, certain individuals, they do report up that it is positive in the UTI. It is positive in UTI. Yes, it is there because it shows cross reactions. This particular Salmonella, this shows cross reactions, and the way this particular kit is being made. So that is a non-specific stuffs are there in that which cross reacts with others. You must have heard of a particular thing, DMAX, heterophile agglutination test. There is a cross reactivity between distant relatives. Okay, those who belongs to different families. In them, the cross reactivity is there. That is what is the point why it comes positive even in this all. So that's the reason that this is not a very good test. So prefer something else. And IgM typhoid not exactly comes positive, but yes, every test have its own demerits also and limitations also. You are also right in commenting up that yes, it does come positive. That's true. Okay. So this is there, guys, and these are, this might be a short note also, that what are the various biological false positive conditions in which the Widal test can come positive. So these are there: infectious mononucleosis, COVID-19, malaria, nephrotic syndrome, SLE, even UTI. Okay. Now, other than that, other than the Widal test, let's talk about the stool and urine culture. Okay, which is in the third and the fourth week, stool and the urine culture. So as you know, guys, that to bring up any sort of a sample to a proper lab, you need a transport media. Okay, to bring up any particular sample to the lab, actually you need what? You need a proper transport media. Now, what is the properties of a transport media? Transport media is, what is transport media? Transport media is which maintains the viability of the organism but does not allow the multiplication. Because if the transient transportation time is more, most of the bacteria will be in the decline phase when you bring them into the lab. That's why ideally the sample should be put up in a transport media. And what is the transport media for Salmonella? If somebody asks you, answer is SAX. SAX buffered glycerol saline. That is the transport media which is being used even for Shigella, and it is for Salmonella. Here we are talking about Salmonella. So SAX buffered glycerol saline. That is the media which is being used as a transport media for stool and urine culture. And obviously we are suspecting what? Salmonella infection. Now, interestingly, here you can use 𝗘𝗏𝗄𝗃 also. Guys, we know the 𝗘𝗏𝗃 is used for what? Vibrio cholerae. But here also you can use what? 𝗘𝗏𝗃. In which particular one? In the stool and urine culture suspected case of Salmonella infection, Salmonella typhi, typhoid fever, you can have 𝗘𝗏𝗃 also for the stool. Okay. Now, talking about the enrichment media. Okay, talking about what? Enrichment media. The first thing to be remembered regarding enrichment media is it solid or liquid? Enrichment is always liquid. And which one is used? Selenite F broth. Which one is used? Selenite F broth. This is the enrichment media used for Salmonella typhi. Okay. Selenite F broth. In fact, this is also used for Shigella. So basically, Salmonella and Shigella, they go hand in hand. If we talk about the transport media also, same, Salmonella, Shigella, Sachs, buffer, glycosylline. Enrichment media, selenide broth. For Salmonella, Shigella, both. Okay, and enrichment is what, as the name suggests, it enriches the important counts, whichever bacteria which you want to grow proper, that is being enriched by what? This enrichment media. Now coming to the selective media, in which only what will grow? Either the Salmonella or Salmonella Shigella at the most. So if somebody asks you that which is the best selective media for Salmonella typhi, the answer is the best one is Wilson and Blair. Okay, what is the best? Wilson and Blair. And Wilson and Blair, which sort of colonies they come over it? Jet black colonies. Okay, which sort of a colonies they come on the Wilson and Blair of Salmonella typhi? Answer is jet black colonies. And important to know is that it is exclusive of Salmonella typhi. No other bacteria can grow up on this. It is exclusive of whom? Exclusive of Salmonella typhi. Which one? Wilson and Blair. And which sort of colonies they come? Jet black colonies. Okay. Now, these all in the exam definitely will confuse. And how to remember the things? Remember like this. Salmonella is having what? Salman. So Salman is the actor which is having which particular jet with him? Black jet. Okay. And in that black jet, that fellow have gone to meet whom? Tony Blair. Okay, the Prime Minister. So remember like this, these upset associations definitely helps in the exam. Okay. So Salmonella typhi, Salman is having which sort of a jet? Black jet. And in that fellow have gone to meet whom? Tony Blair. So at least you will have an idea that which is the best selective media for Salmonella. This is this. Now, other than that, which others you can use? You can use DCA. You can use XLD. Okay. You can use DCA. You can use XLD. And there is a gram-negative media only. The name is gram-negative media. That can also be used. Then you have Salmonella Shigella agar. That can also be used. These are the various medias which can be used for Salmonella Shigella both. But the exclusive one is which one? Wilson and Blair. The exclusive one is which one? Wilson and Blair. What is DCA? 𝗏𝗃𝗃𝗏 agar. What is DCA? 𝗏𝗃𝗃𝗏 agar. What is XLD? Xylose lysine deoxycholate. Okay, what is XLD? Xylose lysine deoxycholate. GN is gram negative. SS is Salmonella Shigella agar. Salmonella Shigella agar is SS agar. These are the various culture medias which you use for Salmonella as well as Shigella because they go hand in hand. They are brother and sisters. But exclusive one, if somebody asks for Salmonella typhi, is Wilson and Blair. On that, which sort of colonies they come? Jet black colonies. Which sort of colonies they come, guys? Jet black colonies. And how to remember? Salman have gone in that black jet to meet whom? Tony Blair. Is it fine? So these are the various culture medias which you should know along with enrichment, along with transport media for the Salmonella typhi. Okay. So this is there. Other than that, what else you need to remember regarding this typhoid stuff? So basically, you know, in this particular one, that everybody heard like here up OH, but there is one more antigen that is termed as VI. And this particular VI, okay, this VI surrounds the O mostly. And VI stands for what, guys? Virulence. VI stands for what? Virulence. And this particular VI antigen, if it is present, it is more virulent Salmonella typhi. So basically, you need to find out in a particular drain water that how much virulent typhoid Salmonella typhi is present. So basically that is termed as what? Epidemiological typing. So epidemiological typing is which sort of a typing? 𝗣𝗏 typing or 𝗣𝗏, whatever you call it. Actually it is 𝗏. So 𝗣𝗏 typing is being done for the epidemiological survey which you want to do up for your particular area that in your drain, is this virulent Salmonella typhi present or not? So this is also one of the important things as per the societal stuff is concerned, that which typing is being done in the PSM for finding out the virulent Salmonella typhi. Okay, it is not always present, but this suggests more virulence for sure. Okay, so that is one of the points. Then, what is a chronic carrier of Salmonella typhi? The chronic carrier of Salmonella typhi is one that which is holding up this for more than 1 year, and which is the famous chronic carrier of this was typhoid Mary. Okay, there was a lot of epidemics of typhoid fever because of what? Because of improper hygiene. Okay, because the main mechanism by which it happens is fecal oral contamination. So this particular typhoid Mary was very, very unhygienic fellow. Okay, so if you want an example that if you do not wash your hands after going to the toilet and still being so famous for that, that is the typhoid Mary. And because this individual was a chef responsible for a number of outbreaks of this particular one and continuously shedding also in the stool sample the Salmonella typhi. Okay, so these are the reasons why again and again these sorts of outbreaks were happening because of typhoid Mary. She herself was also not knowing for sure, but this individual was responsible for causing up so many deaths also because of that typhoid outbreak. And you must have seen in your population, in your relatives also, that some individuals they get the typhoid fever again and again in a year. Twice they might have, thrice they might have. What is the reason? Reason is they are chronic carriers of it. Okay, and where is the Salmonella typhi sitting there in them? In the gallbladder. Okay, and what you need to do for that? You need to remove the gallbladder and you should like give up the proper antibiotics to cover up the infection. Okay, so these all are to be done if you are reporting the typhoid fever again and again for an individual patient. So definitely that fellow is a chronic carrier. Is it fine? So that is also to be remembered, and typhoid Mary is one of the greats which have caused a lot of outbreaks. Fine. Now, important is that what is the drug of choice for typhoid fever? The drug of choice for typhoid fever is third generation cephalosporins, and obviously that is ceftriaxone. Okay, that is what? Ceftriaxone. This is what is the drug of choice. And if you don't want to go for these injectables and all, then 𝗍𝗲 is also being used in the dose of 1000 mg per day for 5 days. And that also found to be effective in this particular one. Okay. Azithromycin. This is the story of Salmonella typhi, which you should know. And their brothers and sisters are NST. And what is NST? Non-Salmonella typhi. What is NST? Non-Salmonella typhi. And which important bacteria they come in this non-Salmonella typhi? One is Salmonella typhimurium. Okay. One is Salmonella enteritis. These particular two names are important, and they leads to what? They leads to gastroenteritis. Okay, they leads to what, guys? Gastroenteritis. And important is that this gastroenteritis associates with what? Poultry bird product contamination. Okay, if the poultry bird product is contaminated, this might happen what? Gastroenteritis because of having this infected poultry bird products. Okay, this is there. Majority is by this Salmonella typhimurium. And typhimurium is such an organism which can enter the intact eggshell. This typhimurium can enter what, guys? Intact eggshell. Means from outside, the egg, hen's egg, poultry egg, looks like perfectly normal. But after having it, the person lands up in hospital with a massive episode of what? gastroenteritis. So if somebody asks you that which organism is capable of entering up the egg in such a way that from outside you can't make it, this is the one. It enters the intact eggshell. Is it fine? So this is also one of the things. And there is one which is termed as Salmonella 𝗂𝗂𝗃𝗃. And this Salmonella 𝗂𝗂𝗃𝗃 is the one which associates with what, guys? Septicemia. This associates with what? Septicemia. Everything is being asked in and out of Salmonella. So you should know a lot of things regarding the Salmonella. Is it fine, guys? And drug of choice for NST is said to be what? Ciprofloxacin. Ciprofloxacin is the drug of choice for this particular NST. Fine. So these are the important points which you should know regarding the Salmonella typhi and NST fellows. And the lab diagnosis is a must question and must be knowing up. In the second year, this question was being asked for sure, either in the Viva or either in the short note or in the long question regarding the Salmonella stuff. Now, in a quick revision, if I like to revise the important points of it. First of all, you should know that there is not a major difference between the typhoid fever and enteric fever. It is extra paratyphi ABC, which we term at enteric fever. Otherwise, they are same. Okay, which scheme is used up to classify that? Answer is Kaufman-White scheme, and it is about 2300 serotypes of Salmonella according to the Kaufman-White. Now it is obsolete. Typhoid fever, fecal contamination, and how much is the loading dose? 10⁻³ to 10⁻⁶ bacilli. That should be there to cause the infection. Incubation period of typhoid fever, how much? 1 to 2 weeks. Which particular cells are involved of intestine? Mucosal cells. And there is a unique phenomena which is observed in Salmonella pathogenesis also, Shigella also, and that is bacteria-mediated endocytosis. And why they try to endocytose? Because they have number of mechanisms to survive because of this endocytosis, like Tier 3 system, 4Q, number of others are there. Don't get deep into that. Bacterial mediated endocytosis is there. Okay, what are the clinical features? Step ladder pattern, that with every step it goes for like above, but it comes down but never touches the baseline. This is what is step ladder pattern. Rose spots are observed over the trunk and other areas. Pea soup diarrhea or constipation can be there in this. Okay, either it can form as the diarrhea or in the form of constipation in presence of either way it can be. So don't confuse in this. Complications of this particular one. Complications is GI hemorrhage. This can happen. Obviously, how? Because of perforation. And perforation leads to which sort of ulcer? Longitudinal ulcer. Whereas transverse is seen in TB and flash is seen in MBBS. That is 𝗬𝗲𝗃𝗏 histolytica. Is it fine? Then these particular clinical signs like Faggot sign, relative bradycardia, with every 1 degree increase, there is 10 beats per minute increase tachycardia. But in this, it is only 5 to 6. So that is termed as relative bradycardia. Leukocyte count also plays a role. That is, it can be less, it can be normal, and it can be increased. So variable presentation is there of the TLC. Important is lab diagnosis. Lab diagnosis is BASU, the age-old mnemonic. That is blood culture, bone marrow culture, even clot culture is there. Okay, bone marrow culture is the best, but it is not feasible. Why? Because bone marrow is not easy to retrieve. So that's why you go for what? Blood. And in the blood, what is dilution now? 1:5. Before it was 1:10. Preferred is 1:5 now. And 1:5 is what? 10 ml here, 50 ml of this particular bile broth or glucose broth is taken. And this particular dilution is maintained. And for how much time you have to wait up? For 3 days for the initial report and for 7 days for final report. And what should be added to this bottle? SPS, sodium polyanethol sulfonate, which is the anticoagulant mainly, and it have a resin action also. Because of resin action, it removes the antibiotic. Okay, so why antibiotic we need to remove? Because in India, everybody comes with the culture only when the antibiotic failed. So that is what is the reason. Then comes then second week, agglutination. Agglutination is Widal test. Widal test is what? Antibodies against O and H that you look out for. And the ratio is like titers are more than 1:100 for this. That is O. And for the H, it is more than 1:200. That is also being sorted. Okay. It is being said that certain titers which you observe in the initial one, that should fourfold increase after 2 weeks. Then only you will confirm the case of typhoid. These all are bookish. Fine. Now, we prefer to go for IgM typhi dot, and results are good than the Widal for sure, and it is easy to be done. important regarding Widal is that why it is not a good test nowadays, because it is a highly sensitive, poorly specific, and biologically false positive reactions. They are being there. That is infectious mononucleosis. It can be positive. COVID-19, malaria, nephrotic, SLE, and even UTI also, as you are saying up in the comments. That's true. Okay. Stool and the urine culture, whenever you're going for the third week stuff, transport media is needed. Sachs buffer equals can be 𝗘𝗏 also, which is there in Vibrio. Enrichment media is salinity type broth. F is fecal stuff, and Salmonella shigella it can be used. Best selective media is Wilson and Blair. Others than Wilson and Blair, Wilson and Blair is the selective for Salmonella typhi only. It is not for Shigella. But others can be used for Shigella, DCA, XLD, GN, and SS. They can be used. Everybody knows about O and H. In the antigens, VI is also there. VI mostly covers up the O, okay, and makes it inagglutinable sometimes. And it is used 𝗣𝗏𝗃 typing for epidemiological typing. It is good, and the PSM fellows that does it. So to know the virulence of Salmonella typhi. Okay, chronic carriers, more than 1 year. If somebody is there shedding up in the stool, this particular Salmonella typhi, that is termed as chronic carrier. Typhoid Mary used to be the greatest carrier and caused up a lot of outbreaks. Okay, drug of choice as such for typhoid is third generation 𝗘𝗏𝘃𝗃, that is ceftriaxone. And there is one more class that is termed as NST, non-salmonella typhi. Typing by enteritis leads to gastroenteritis and 𝗘𝗅_𝗺 septicemia. Okay, and drug of choice here it is Cipro. Along with that, now we have vaccines also for this one, that is Typhi 21A, that is also being used. And number of others, they are coming up day by day, the vaccines for the Salmonella typhi or typhoid. Okay, so these are also there and they are being given to the child and they are found to be moderately efficacious. So with this, we end up to today's session. Okay, I hope you have got some insights and you will able to write up in the exam now as a question if it comes, and in the Viva definitely you will rock now. Okay, so thank you so much guys. See you. Bye bye. Next time we'll go for the UTI. This time in the NEET PG also a lot of questions. The UTI they came. So we'll discuss of the UTI in slight bit detail, that what sort of significant bacteria is there, what you count up, what is the features, and which particular bacteria specifically does E. coli. Everybody knows, but which particular E. coli does the UTI and all. So next time we'll cover up that thing also. So thank you so much. We have revised it, and if you revise this once, your topic is done. Okay. So thank you. Any questions if you want to ask? Yes, in the live chat. Any questions if you want to ask? Please. Any questions which you have? Yes, please. No? So let's meet you next class. Bye.